Doctor, what is the significance of that there were no significant changes? Again, the fact that he was not having ischemia during exercise testing is a good result during exercise testing, in my opinion. Doctor, I asked you before about an abnormal heart rhythm prior to the stress test. During the exercise portion of the stress test, was there any abnormal heart rhythm for this patient? Do you recall? No. Doctor, after the patient stopped exercising, does the record show what happened to his blood pressure? Yes. What happened to his blood pressure? It dropped. It dropped to 60. Is that correct? Yes. Doctor, during the peak of exercise, the blood pressure was measured at 158/60. Is that right? Yes. Doctor, do you have an opinion with a reasonable degree of medical certainty as to what caused the drop in blood pressure from the time the patient stopped exercising until he was found to be 60/120? I have an opinion. What is your opinion, doctor? It is fairly well described phenomenon in the literature and in my experience called post-exercise hypotension, post-exercise drop in blood pressure. Doctor, what is the standard of care regarding treatment of a patient who has that sudden drop in blood pressure as Mr. Hock did? The standard of care usually is to sit the patient down or lie them down, see if that is assuming the recumbent position and taking away the gravity aspect of pooling the blood in the legs, whether just assuming the supine or recumbent position would cause the blood pressure to come back up again. If not, we increase fluids into the patient's vein with an intravenous. Doctor, did Dr. Yale sit the patient down and then lay the patient down? He did. What happened to the blood pressure when he did that? It seemed to come back toward baseline. Is that what you had hoped happened? I would hope so. Doctor, based upon the records, we know that Dr. Yale described this as a postural hypotension. Technically, that's not correct, right? I would agree. But with regard to the drop in the blood pressure, what is called for is for Dr. Yale to change the position of the patient in order to, in an attempt to bring the blood pressure up. Is that right? Yes. Is that what he did here? Yes. Doctor, do you have an opinion with a reasonable degree of medical certainty as to whether Dr. Yale appropriately changed the position of the patient to bring the blood pressure up? Yes. What is your opinion? He did. Doctor, we know from the record that this patient complained of chest pain after the exercise stopped for approximately 5 minutes into the recovery phase. Are you aware of that? Yes. Doctor, is that the chest pain that begins at exercise and lasts into the resting period? Is that resting angina? No. What is that? That's exercise angina. Even when I described stable angina, a patient has the chest pain during a certain amount of walking. It occurs during walking, and most times it lasts 5 to 6 minutes when the patient stops at rest. It's getting better, but it's concerted exertional angina. It's not rest pain. Doctor, are you familiar with Dr. Yale's impression following this stress test? Yes. Okay, and the first impression was borderline positive stress, EKG, changes for inferior wall, myocardial ischemia. Do you recall that being one of his impressions, doctor? I'm sorry. Do you recall that being one of his impressions? Yes, I do recall. Doctor, do you agree with that impression? Yes. Doctor, are you aware that Dr. Weiss testified that this was not a borderline test, but it was a grossly positive test? Yes. Defendant's counsel, just objection to the word grossly, that it was a positive test, not a borderline test. Do you recall reading that testimony? I do. Do you agree with Dr. Weiss? No. Tell us what you disagree with Dr. Weiss in regard to his interpretation of the stress test. Let me just caution that this is only the interpretation of the exercise electrocardiogram. I think we both agree the patient had chest pain during exercise, and that is an abnormal finding. I misspoke. With regard to the EKG itself, could you tell us why you disagree with Dr. Weiss's statement that it was a positive? I called it equivocal or borderline position. Many individuals or cardiologists might call it mildly abnormal. The reason is, first of all, when I looked at it and measured it carefully, I got somewhere between 0.5 and 1 millimeter of ST depression. The standard interpretation in the exercise test is that an individual should have 1 millimeter or more of ST depression, either during exercise or recovery in 3 executive beats. When I measured them, some of the leads, it looked like 0.5 millimeters. Some of the leads looked like 1 millimeter. I called it between 0.5 and 1 millimeter, so I would call that borderline or equivocal. But there are other reasons why I would be very suspicious about this result. One reason is that in patients with right bundle branch blockage, sometimes you can't read the electrocardiogram in certain leads. The ST depression didn't occur in the leads that the textbooks or standard to say that you can't read the electrocardiogram, but in my experience, some patients who have right bundle branch blockage can have falsely abnormal EKG changes in other leads besides the standard V1 through V3 leads. They could have ST depression, which is not indicative of coronary blockages, but only based on the right bundle branch block pattern. The second reason I'm a little more cautious in my experience and in reading the literature, changes that only occur in the inferior leads of the heart are less likely to be indicative of coronary artery disease, are less likely to be absolutely abnormal.
That one was harder.
There was exactly